It's happening. Oh shoot, the agenda. Here's our agenda. We have quorum. I don't know why I'm not able to scroll on it. Updates of, I don't know why, I think that the financials were not attached to your calendar invitation. I apologize for that. The quick and uh, important update is that we are on track to underspend and we are well within our budget. Um, no flags to raise, no concerns to identify. Contracts are proceeding for the user interface updates on the dashboard to bring in education data, disability data, and the a note on that. RealD and SOGI. So RealD is race, ethnicity, ability or disability, and language. As well as SOGI, which is sexual orientation and gender identity. The state is pausing collection of and sharing of all of that data due to risks posed by the federal administration for how that data will be used. And so we are pausing on our sharing of that data as well as part of the state. But we are going to try to build the user interface in a way that would allow that to be turned on if at some point we decided that it was something we did indeed want to share. So that contract is continuing as originally drafted with creating the capacity to share demographic information, but we will not be turning that piece on. Um, there, we are in process on a contract with Elliott to continue their services for youth committee, and put them on the same timeline that Vanessa and Reap are on. That sort of lived experience support process seems to be really working. So Elliott's contract was scheduled to terminate on August 31st of this year. They are being given a 2-year renewal cycle, with a 10-year total lifespan so that each of us gets to say no every 2 years, but we are renewing for the next 2 years for Elliott for now. Vanessa's contract is being extended through the end of the biennium. And then we are still in process with the system of care evaluation, for the fiscal assessment, as well as the System of Care Institute orientation process, and we are drafting an RFP for the financial fiscal assessment work that the Investments in Finance Committee is overseeing and going to be partnering once we get those contractors online. Any questions about budgetary updates, contracting updates, etc.? Did we need to take roll? I'm sorry, I just jumped right into it. I apologize, Chair Rodakowski.
I don't know that we do.
Okay.
Do we?
I don't know. I mean, we're here. We have 5 people. That's
Yeah.
quorum for exec.
Yeah. I think
Leah,
we're okay.
Adam, Dan, Andrew, Jasit, Ebony.
Yeah.
We have our LSOC representative and Heather Pasco, just keeping an eye on us.
Hmm.
So I think we're okay.
We need somebody to do that. So I'm glad Heather's willing.
Thanks for helping us out, Heather, keeping us honest.
Yeah. No, I think we're good.
Okay. Um, oh, here we go. Then now we are at committee updates, which apparently you're facilitating, Adam.
Well, look at that. First up, yeah, mostly for entertainment. Investments in finance. We got any update from y'all?
Can give an update on that. Um, so as a brief reminder, the scope for Investments in Finance Committee is um, overseeing the SOCAC budget itself, including the grants that we give to the tribes and local systems, as well as, so that's sort of like our internal scope, and then our Our external scope is providing input and recommendations regarding the financing mechanisms for the overall system of care in the state. That's what we're about. A couple of quick updates. We completed our charter. I just signed it a couple of minutes ago and sent it on its way for Allison to sign it. In our May meeting, we had a good overview of the SOCAC budget, so we get an idea of where those dollars are going. We do still have a number of youth and family seats open and a tribal seat open on the committee. So if you know people who might fit the bill and might be interested in that, that would be terrific to get those seats filled. Our main working projects at the moment are, as Anna mentioned, the study of system financial inputs and outputs. The request for proposal is nearly complete and will be released. I'm not sure, but I think later this month or maybe sometime next month. We're also contracting with Portland State University to study our grant process. Currently, we provide non-competitive grants of $200,000 to each local system of care and to each tribe. And we're wanting to evaluate whether that's sort of the way that we're doing that is the best way to do it. There are some questions around the equitability of that arrangement, and whether the dollars being spent, I guess maybe how well they align with our strategic plan would be a way of putting that. If we do think about making some changes after we get that study back, we could anticipate that there would be a lot of people who would not be happy about that. I think there's a lot of investment in those investments, as you will, in the form that they're at. So that would be a significant conversation to have with our local systems and with other system partners. We also, over the summer, have budget presentations coming from the agencies. And so main purpose of those, I would say, one is to educate ourselves. And then in alignment with our mission to provide input into financing mechanisms and priorities, for us to give feedback to agency staff during those. We do have some concerns about like how that's going to go. We haven't had our first presentation yet, but we don't really know how much transparency we're going to get from the agencies. We don't necessarily have the agency, the key responsible people from the agencies that are going to be giving the presentation. We don't know like how much detail there's going to be. There's one of them made clear, like we can't talk about specific cuts at this point that might be coming related to HR1. And we don't really know how much impact we will have. And then there's people like me who don't even feel like we have enough knowledge to make informed recommendations. So it's going to be a real learning experience for all of us. And this will be our first try at this particular process, and we'll see how it goes and probably get better at it as we go along. That is what I have to yak at you about. Be happy to have any conversation or questions around any of that.
Adam Peterson has had a patiently waiting hand up for a bit.
Yeah, I just, with some of the feedback that came in at the very end of our last meeting, I wonder if it would be a good idea to talk about those $200,000 grants a little bit more to each of the tribes. And because I believe that's what, $1.8 million that's invested of SOCAC money into system of care and creating that connection between system of care and our the affiliated tribes of Oregon. And so I think all of us could benefit from just understanding what that connection is and where some of that funding is going, because it's something we haven't really talked about, and I think it could be, or I haven't heard it if we have talked about it, and it would be, to me, like an interesting, I would like to hear that given the feedback that we got at the end of the full meeting.
Thanks, Adam. I definitely, Dan, there's, if you want to speak to this, you're very welcome to, but I think that's something for sure to dig into. We're gonna come back to that conversation in the September full council meeting, Adam, and because it was just sort of like at the very end of the meeting, this like major issue gets raised, and I'm like, oh, there's 3 minutes left. Like, we're gonna have this conversation later. But Christina, who is the new family rep, the first new family rep stepping into the Investments and Finance Committee, and I will say is she's taking it super seriously. She's watched all the recorded meetings, she's read the whole budget. She reached out to me after that conversation yesterday and was like, I see we spend 24% of our budget on tribal grants. Like, that didn't come up at all, And so I think having that conversation, maybe when we're talking about the fiscal assessment or the grant audit, right? Like really digging in the Investments and Finance Committee, just highlighting that a little bit as they're talking about the grants program. Because they have their meeting arc set out. They don't have anything scheduled for September or October. So it could be that those are good times, Dan, to have more detailed conversation about the tribal grants specifically and how we do manage them very differently, Adam, than we do the CCO connected grants.
Thank you, Anna. I was going to ask you to respond to that. My impression, I think, from comments you made at that meeting is that it doesn't feel like we have a whole lot of leeway to do those differently. Is that is that fair? Is that an accurate statement?
Yeah, we would need to use some kind of tribal consultation process that we don't yet have established if we wanted to change that funding formula. But to Adam's point, I think understanding what are we funding, what are the impacts, like we get reports from them, and like I have this incredibly beautiful video of what Coquille Tribe has done with our grant funding that they don't want us sharing publicly, and so I can't share it in a public meeting because anything I would share would then become public record. You know what I mean? So like
Mhm.
we have in order to honor their sovereign status, sometimes it creates public communication challenges. But we do get reports from them and they are doing wonderful stuff with our funds. It's just a little bit of a daisy chain to figure out how to communicate that to the committee without violating their preferences. And that's only one tribe that doesn't want their grant report to be made public. But Christy and Dan, you guys could dig into that in one of your planning meetings maybe and think about how do you communicate all that information in a way that does feel respectful to the tribes.
That would be great. Thank you. Ebony, you've got your hand up.
And maybe this is irrelevant technically, but I know OHA has a tribal policy that guides, any funds that come in. And so, there's kind of like OHA has committed through policy, always having some type of a tribal set aside. And I forget kind of the algorithm, if you will. And I also know that SOCAC also operates, outside of the agency, but, just wanted to highlight that for whatever it's worth.
Well, even if that's not, binding on SOCAC, it would certainly be a useful thing for us to look at in terms of, well, here's how a major partner agency of ours approaches it. I think that's really important information to have. Would you be able to forward that to us?
Yeah, I can.
Thank you.
Just because this conversation's going to be on YouTube, I think the other piece of that, Dan, to consider is the system of care grants that DHS issues also to the 9 tribes around this system of care work that they got added to their continuing service level budget when Senate Bill 1 was passed and created the System of Care Advisory Council. Christy has that information, and when you have, I'm writing some notes down for things for you all to talk about how you might want to bring this to the Investments and Finance Committee. I'll ask her to also bring what is the DHS Child Welfare System of Care Grant Fund formula, because it's very different from ours. It's based on the number of children in each tribe and some other details that I'm not able to pull out of the top of my head. But we'll bring all of that to you, and you can decide how you all want to talk about it in Investments and Finance.
That's great. That also seems like it'd be a relevant piece for us to tuck away for whatever contract ends up doing that. Deepen
Fiscal
out,
assessment.
yeah, fiscal assessment for us.
Yep. Cool. Anything else on Investments and Finance, sir?
You muted yourself, so we don't know what you said the last sentence, but
I said, then I'll shut up and let Adam facilitate this meeting.
hey, I facilitate so many dang meetings. I am perfectly okay with somebody taking over. So you are not stepping on my toes. In fact, I think I've been in meetings this entire day since 8 a.m. How about program and policy? What do we got going?
I will say that, Anna, I'll need your help a little. I don't know if Leah's on or not, but we have kind of done a forecast around setting, key agenda topics through, I think, mid-fall at least. We just had a meeting where but never mind, I'm about to make something up. But I think that, we're mindful of wanting to kind of understand the continued impacts and implications of not only HR1, but then just also, kind of the agency budget, as agencies have to reconcile to kind of, any state general fund deficits, but then wanting to, be clear around then kind of, how the agency's strategic prioritizations, what those are, and then how they do line up then with the SOCAC strategic priority and strategic plan. I know too that we talked about, we know that November is a big month, and so making sure that we reaffirm the role and the scope of that table as we, start to understand the results of November, just to make sure that we are in lockstep with, again, supporting the governor's priorities in addition to the SOCAC strategic plan. And then Anna, my brain is, I'm drawing a blank, so I don't know if there's anything you would add.
We got more. We got you, Ebony.
Thank-
Leah's here and she's got something to add. And then if there's any gaps left at that point, I'll step in and fill them.
Yeah, so I was just gonna mention we'll also be talking about Christy Hudson's, Christy's not in this one, school-based services report discussion, which I'll also talk about on the affinity space report, but because we just get to talk about that a lot today. But that's talking about school-based services in regards to disability services and mental health. And then we also have a sort of a deadline coming up, July 15th, about whether or not we're going to be ready to have language for one of the bills or both of the bills. Is it both of the bills or is it just the one?
We need to get the council composition bill language ready to go by July 15th. And Leah, I'm going to talk to you and Ebony offline about the placeholder.
Fabulous. And that is the update I had for that. So
That's great. So there's no gaps. So we're done with the program and policy report out. And it sounds like Adam is like fine with me facilitating. I do it all the time because I just take over meetings. So let me just invite Andrew to provide any data and evaluation committee updates that he has to offer.
Yeah, so I have been a very sort of poor co-chair, having missed the last meeting and kind of uh, some other stuff in the past couple weeks. But I can tell you that in the last meeting, which was, gosh, on the 9th, I think,
Mhm.
um, they were really focused. I wasn't there. I don't have the notes yet, but they were really focused on the dashboard. There are some modifications that we can be making to the dashboard to make it more sort of usable, sort of user friendly, and kind of have cleaner information. So that was the focus of this past meeting. Prior to that, we passed our charter. We've got what I think is a pretty solid charter, with a number of kind of key activities. But to me personally, and I think that most of the people on the committee share this, one of our biggest duties of this committee is to monitor the results of the strategic plan. And there's a whole lot of other stuff in the charter, and we have, I don't know, 9 meetings left that are like an hour long, and then we'll have a few things outside the meeting. So I think, like every committee of ever, we probably bit off more than we can chew. But if there's anything that we accomplish that, I'm going to be driving for, getting the nuts and bolts in place to measure the impact of the strategic plan. And specifically, I'm going to put in the chat, this is in that little strategic plan summary. It's in the big document. These are the things that we need to be able to talk about coherently, to know where we are, to know where we're going. We have measures of all of these. Sadly, I'm going to say many of the measures are indirect measures. They're not, we don't have administrative data to answer all these questions. But we do have, Anna's showing more stuff. Somebody's showing more stuff.
It's me.
Yeah. So we've got these plans. But my plan is to make sure that, if you ask a question about how are we doing with decreasing the percentage of youth boarded in the emergency department by the end of this year, we're going to know about that. We're going to be able to report that in a coherent way. Well, we may not know the cleanest answers to every single one of these, but we'll have the things in place that will be a step in the right direction.
So yeah, Andrew, this is the Andrew has been out in a way, and Jackie's also been out in a way, and so and Cody has never staffed a committee before and was pretty anxious about the responsibilities, and so I sat with him and we drafted a topics arch for the rest of the year. So these are your meeting dates on the left here, Andrew, and you'll see that Cody heard you with regard to wanting to really dig in. So you have strategic plan metrics, which Cody is talking about thinking of moving sooner, but for the
Yeah, we
September
talked about
meeting,
it. We
the
talked
October
about it.
meeting, and then again, really digging in on these two will kind of be related to your metrics as well. So cross-system data sharing is part of our strategic plan and our outcomes intentions. And then the data requests that local systems of care use are about the data we collect versus the data that we compare ourselves to. So you're kind of really spending the second half of the year digging in deeply to those topics, at least as far as what you've got planned so far, unless you all as chairs choose to pivot.
Yeah, no, we won't. The only thing I don't want the committee to turn into is a whole bunch of report outs. We're going to get a report from so and so on such and such, and then next month we're going to get another report from we need to be able to kind of answer to the charge that we've given ourselves. And anyway,
Yeah,
that's
to do some real work.
yeah.
Absolutely. So, yeah, feel free to continue to work with Cody on that, to refine this and make sure that it is what you want it to be. And then, thinking about maybe inviting Dr. Ritu to take an additional leadership role in that space so that as you and Jackie do whatever needs to be done, we have somebody, to also be a backup leader for Cody to rely on, as people's experiences on the council have been changing over the course of the last few months.
Right on. That concludes my report.
Thank you, sir. Membership and development, Adam Peterson.
Hey, we are real busy with recruitment of our four lived experience voices. Anna and I were able to meet with the OIA leadership throughout the state at one of their meetings to talk through recruitment. And I have a follow up with NAMI youth group or youth affinity council to follow up with as well. And so we are at this point really engaging wherever anyone will engage with us for that recruitment. We've got a schedule for these, like the preferred we're calling it the like kind of the preferred review date is going to be the beginning of July for any referrals that or anybody who has applied will begin review at that point. And hopefully we find some great fits there. However, it will be a rolling application. So if good folks are coming in after the preferred review, the prioritized review deadline, they would still be considered. We also are starting to begin to look at some of the folks who are rolling off of the council due to their time commitment expiring. We are going to put priority on connecting with our child psychiatry as soon as possible, understanding that we can do either a child psychiatrist or a psychiatric nurse practitioner, we found out, which is going to expand our pool. However, that is still a very, very busy group of folks, and this SOCAC requires a lot more time than most of them have to give. So we're going to really try to begin that recruitment. And then as well as unfortunately, we are also losing Dan Toma from the private insurance world. And that we suspect will also be a bit of a challenging recruitment, or more so than some of the other ones. So those are going to be the ones that we begin pretty much right away as soon as we've finished up this round of our 4 lived experience voices. Also, the Youth Advisory Council and the Family Advisory Council have been hard at work on creating onboarding materials. And so our goal will be to have onboarding material, onboarding process pretty much completed and ready to go by the time that we have these new 4 lived experience voices. So lots going on. We were originally going to only meet once per quarter. This group has shifted to a once monthly, and I honestly don't see that shifting anytime soon with the amount of
Sorry,
work
Adam.
that it's all right. It's all good work. Go ahead, Adam.
Yeah, I think my question is actually for Dan. Dan, did Motor replace you with anyone? Were you just like too great that they're like, we're not even going to try?
Irreplaceable.
Yes, Shiloh Smith is the new director of behavioral health for Moda. She's an LCSW and came to us from Columbia Care.
Okay. Because I'm just thinking, like, one, there's that, right? And then are there spaces where private insurance people talk to each other, like in a similar way that the CCOs do, like through DCBS or something? Or
I think not as much, but there are a couple of spaces like that. There's, at least I is assuming it's still going on. There's like a regulatory group that meets specific to mental health. Shiloh meets with leadership from a couple other plans, like on a monthly basis or something like that.
just thinking about, yeah, how we find a replacement. So,
Helpful questions, Adam. The other thing I will say is that I had an idea while you were talking, Adam Peterson, about a way to recruit some psychiatric nurse practitioners to potentially be interested. So I'll follow up with you about that offline. And then, the other thing I will add to Adam Peterson's report is that all of the material, the onboarding materials that youth and family have contributed, they're like, it's all ready to go. It's just in this giant queue at Pubs, which is the like publications department that's sort of a shared service between the Oregon Health Authority and the Oregon Department of Human Services. Because right now there was all this push to get everything compliant to the ADA accessibility guidelines, and so everybody took everything off of their websites and sent it over to pubs to have it be updated, and then they put the timeline back for the compliance deadline. But Pub still has this like giant queue. And so we're somewhere in it. Like we've gotten confirmation that our orientation manual has been received and assigned a number in the queue. Like it has its little ticket at the DMV and it's just sitting there waiting for its number to finally get called. But it may be a really long time before that actually happens. And so in the short term, all of those materials and suggested edits have been forwarded over to Elliot, who is working in partnership with Zafir, Deceit, a couple of our family, I don't know, Leah, Christina, and some other youth I know for sure. And they are putting together the very first onboarding training for lived experience members of our subcommittees. That will happen January or July 6th at the Human Services Building in Salem in person. And we are figuring out like how to order lunch for people and how to get kids bus tickets and all of the things so that they can come together in Salem as new subcommittee members and learn like what's expected in a subcommittee and how do you get paid and all of those things, Adam, that are in that document, but it will actually be it'll be a first time. The intent is we would do it quarterly so that as committees get new members, we can do that subcommittee orientation opportunity so that it doesn't quite feel as destabilizing or unwelcoming as we saw yesterday in our full council experience when people get thrown in without orientation. Affinity space reports. Leah, FAC.
Hey, all again. So I kind of touched on the fact that we were involved in the school-based services work group. We did that. So we did a work group last Tuesday with a bunch of our FAC members. I think it was really great. We're evaluating all the information right now and kind of pulling things together so that we can get that over to Christy so she can incorporate it into her brief. We are actively recruiting for the family voices on all the subcommittees. We're ending the application portion of that on Friday. They have to have their applications done by Friday, and then we'll sit down and evaluate who those folks are next week. And it looks like we have enough applicants, even as it stands, for at least one person per subcommittee. But I suspect by the time we're done on Friday, we'll have the 2 spaces filled on all of the subcommittees. And we have another meeting tomorrow afternoon of the FAC, so we'll be going over all of this with them. And I am here to ask of all of the SOCAC from the FAC that we know that there's a temptation to lean pretty heavily on data and numbers and it's easier, right? Because that's what we need numbers to tell us how things are going. But the FAC would like to ask that we temper that need for quantifiable data points with the understanding that we're talking about humans, and that means that what we're looking at, what we're hearing is actually qualitative data that they've been trying to share for years, decades. And it doesn't, it's not just the families, right? We need to hear the words from providers. We need to hear the words from the families because that's the data we're seeking, not the numbers. Like the numbers are great and they help us make charts and whatever, but the data that we're seeking is the words that they're saying. So that is the ask from the FAC.
Thanks, Leah. That's important. I will not to say that this is a solution to the problem, but one of the steps that is being taken at the Oregon Health Authority in that direction is that they've actually identified Cody Welty as the person that they want to become their qualitative analysis expert within the behavioral whatever team he's actually employed by. And so they're asking him to work in connection with us to really build his chops around qualitative data and then advise the Oregon Health Authority and the Oregon Department of Human Services on how to better integrate qualitative information to the way that we do our work. So heard and steps taken in the right direction. They are not taking him from us at all. They are asking him to build that skill through us. And we said, heck yeah, please do. That's perfect alignment with our goals. Yes, did you know he's a doctor? I love calling him Dr. Cody Welty. I actually kind of made him cry when I was like, dude, I'm gonna call you Cody, Dr. Cody Welty, because you earned that. And he was like, oh, I feel so awkward. So yeah, Dr. Cody Welty is going to become a qualitative data specialist. Any questions or feedback besides that for Leah? Okay. Jasit Safir, Youth Council or Youth Affinity Space.
Hello.
Hello.
I mean, no real major updates. We finally did our final voting on the like youth engagement stuff. I forgot what the exact name of it is because I can't remember names for anything.
Youth Engagement
Um,
Plan.
that one. We finally got a final formal vote on the like thing. So that's done. That's approved. That's ready to go. I've also been kind of hounding folks a little bit to apply for the open seats. And we had some new folks come in. I had a conversation with one of them offline, kind of just going over what SOCEC is and kind of what to expect in here. And they seem interested in the space. So potentially they might be an applicant. But beyond that, we're still ramping up, so there's not a ton else there. I don't know if I'm forgetting anything, Zafir.
Nothing that immediately comes to mind. I feel like you've definitely been a little bit more locked in than I have. So I don't think I have anything to add particularly.
Sweet. So yeah, that's it from Youth Council or Youth Affinity Space.
Cool.
Yes.
Thanks. Yes. Any questions from the community? All right. Next is the local system of care affinity, question mark, question mark. You have a copy of the draft charter for this in your inbox. Christy and I think we discussed this at a previous executive committee meeting, but we attended a portion of the local system of care coordinators annual retreat. And in that conversation, they were really wanting to see some specific implementation around bidirectional communication with the local system of care coordinators. And as we were kind of, Christy and I, listened to that and tried to think about what would be a really functional way to do that. The request was to add a seat to the full council for local system of care coordinators. And we evaluated that as a strategy, and I'm probably going to offend everyone by saying this, but it didn't seem like that would solve the problem because, like, Adam Peterson is on as a CCO rep. That doesn't mean that every CCO knows what's happening with system of care. And Andrew Grover is on as a provider rep, and it doesn't mean that every provider knows what's up with System of Care Advisory Council, right? We were like, our members inform us. They don't necessarily inform their entire system that they represent, right? It isn't really the bidirectionality that you might imagine when you sit somewhere else and think like, oh, all these other people have seats at the table, right? Private insurance is not paying a ton of attention to what we do, despite Dan Toma's best efforts, right? And so we were like, maybe that's not really the solution that you're seeking, but maybe an affinity space is, in the way that the FAC and the YAS have been able to really generate input to the council and receive feedback from the council that feels, I think, a lot more bidirectional, particularly right now in the FAC space. And so that felt like maybe a much more effective strategy to build bidirectional communication, as well as there is a seat for local system of care coordinators on every subcommittee. And so if those folks were similarly representing LSOC voice in our subcommittee spaces in the way that family members are representing family voice and youth members will be representing youth voice in those subcommittees, it would feel like a conversation that is continuing the cycle. So that's what we proposed to them. Christy and I used the charter template and drafted a local system of care affinity group charter. We got some feedback on it from Heather, as well as I think from Tracy. And so, continuing conversation there. One thing that it would affect would be that those committee chairs, an local system of care member, would then become a voting member of the executive team as well. So that would also, improve bidirectional communication and elevate a little bit of authority for those LSOC folks within the work of the council. Dan Toma, did I offend you?
No, you set a good example in not being afraid to offend. So I'm gonna follow your fine example there and maybe be offensive myself. But I think the affinity space is a great idea. I don't know what the what the local folks feel about it. I'm not sure it's enough, and I don't think it's a fair expectation to say, well, having an LSOC seat on SOCAC isn't going to solve the problem because, having me on it doesn't solve a problem. None of us solves a problem by being on it. And to me, it does feel like just a really notable and kind of even bizarre absence from this council. Is like, aren't these people really kind of the linchpin of where the rubber meets the ground? And I know that we struggle with like how big does SOCAC get? That's that's a real concern. But it feels, if it were me, it would feel like a booby prize kind of. To get an affinity space, and I think we should get one. I hope they like the idea, and I hope it flies, because I really do think it's a good idea. But I don't think it needs to be that necessarily just instead of a seat on the council. And I still think it's worth considering whether we can find a good way to make that work.
Yeah. Leah, go ahead.
I was just going to say, I'm in agreement. I think the affinity space is great, but I also think that, if LSOC is doing their jobs right, then they'll be repeating a lot of what's being said in some of the other affinity groups. But that being said, I think that bidirectional doesn't work very well if they're not in a seat here, like a seat being represented in that way.
Adam?
I view it, I think, a little bit differently in that, and I'd be curious, not to put Heather on the spot, but I would also invite Heather into the discussion as a LSOC person. So feel free to speak if you're interested, Heather, not to represent all, but to represent yourself, and you've been around a while. I view it a little bit as like, and this could be wrong also, as like the local system of care coordinators in my long-term vision would almost sit as a part of the System of Care Advisory Council staff instead of being internal to CCOs. as the local like doers and movers of the plan forward. Um, I know that, that's not an easy thing or a simple thing to kind of pull out of the CCO structure, but I think system of care being in the CCOs sometimes then lets all the other system partners walk from system of care. Be like, oh, that's a CCO thing. Um, I know that's not the way it exists currently. I don't know that there is any intent to change that in CCO 3.0 whenever CCO 3.0 happens. But I see the local system of care coordinators as key implementers of the work. But I don't know if a seat at the council really matters. Adam, and I see Leah, you in the chat too.
So I think I think I've told people this. I have sat at every single level of care that there or system of care level that you can sit on, from what's supposed to be the wraparound review committee at some point was considered that, the local advisory councils, then the local executive, and then now the state. And I do feel a lack of connection to the work that's happening at the local level when we're sitting at the state level. Like, and I've been in those shoes, and I think it's a valuable voice. I do think that there is a space for what people are doing at the local level to have that, to if for no other reason than to feel like because they're now, like, I know they have a regular system of care coordinator meeting. Like, if they have that same spokesperson that can bring this is the one thing we really want to bring to the table. I think it makes a difference. I would support movement toward getting a local system of care advisory council representative.
Leah.
Sorry, I know I'm talking a lot. So I was just thinking that, like, we just got through a bunch of interviews with potential comms directors, right? And one of the things that we were talking about is that community voice and how it's unique across the board, across different communities, across the state. If we're not actively welcoming that voice from that, like, that level of the system of care, then how are we getting those community voices into this room?
So I hear you all. I think, like, we meet regularly with the local system of care coordinators. They tell us what they want. We try to do it. I don't know, Heather, if there's anything. Oh, you've come off mute. Do you want to talk?
I didn't come off mute.
You came on camera.
I
Sorry.
turned my camera on so you all could see my face and don't have to like guess what faces I'm making while you're talking.
While we're talking. Really sweet of you. So I think, and Heather can totally disagree with me if she wants to, like, so many efforts have been made by Christy and me to try to create, like, to ensure that local system of care voice is heard. We went to every single LSOC and they participated in the strategic plan. Like, their plans are our plan. I think there's a lot of different perspectives within each different region. I think the LSOCs agree about as often as the tribes agree on how a particular thing should be done at the state. And so, having one voice that represents them maybe isn't real, right? Like the way that Heather does local system of care work is very different because she works at Willamette Health Council and she has a whole team of people who are collaborators with her that are spread across the CCO sort of community engagement operations. It's actually, I think, a really beautiful and cool way to do system of care work at the local regional level. I
But
think there are
there
other.
is a tribal representative though that's supposed to be bringing that voice to the space. Like even though there are 9 different voices, that's the role of that person, is to somehow be that voice. And so I hear you, and I want to push back on that notion that you can't have a representative like if that's the like even if there are opposing viewpoints even within there are 15 16 different CCOs too. I don't represent all of their viewpoints, but I represent a viewpoint within a CCO lens.
Thanks, Adam. I don't love getting interrupted. Um, I don't really see that tribal seat working especially well either. Um, I do see the youth and affinity spaces working a lot more effectively in terms of actually integrating people's voices into the way that the work is done. I will leave it there for now. Dan, you can go ahead.
Thanks. I'm not even sure if this is an appropriate line to go down in this conversation, but like I'm wondering what the reluctance is. Like even if it doesn't solve everything that we would hope that it solves, I wonder, like it feels like there's not just gosh, I don't think that's necessary or maybe the most effective thing that we can do, but even like, yeah, I don't really want to do that. And that, and like I said, that may not be something we want to discuss right here and now, but maybe it is. And so I wanted to just open that up and if it is, to hear about that.
Yeah, I mean, I think I can speak to kind of from my seat as the chair. We are already a massive council. And as far as like size of groups and like when you look at effective group sizes, we are already so large we are less effective because of the size. And so I think continuing to add seats is problematic. We've just kept at it since we started, right? I think we started at 25, now we're at 29. Right? 29? Yeah. Um, and and then if we add a local system of care seat, should we add a Medicaid seat? Should we, we've had a lot of these discussions about all these important people. We don't have DELC at the table, right? Like Department of Early Learning and Care. We've got a lot of folks that deserve space and maybe should have space, but so that's my hesitation is to continue to add seats. I'll shut up in a second of here and let you talk because I think maybe I'm gonna, whether I would agree with you or not, I'd let you talk, but I think I'm gonna agree with you. Uh, and I think maybe then the local system of care coordinator should have an affinity space with the CCO reps attending so that the CCO reps can then carry that voice forward in the way that Jacid and Zafir do for young folks. And I'm going to stop and let Zafir talk. But that would be my maybe alternative solution.
I apologize in advance. I'm having some trouble following, and I want to make sure that I'm getting everyone's points right in my head, and also speaking it out so that everyone can hear the points that are being made, and it's not people going back and forth and assuming or like cherry picking or anything like that. So just so understandings are had. So what I'm hearing is that, at least what I'm understanding, maybe not even what I'm hearing, what I'm understanding is that people want are people asking for a seat for every different local system of care? Is that what I'm hearing? Okay, that's what I thought.
No, they want one, or like the conversation is around adding a seat to the council for a local system of care coordinator, somebody who sits in the role that Heather operates in.
Okay. Would it not make more sense, and this doesn't necessarily have to be operated by the SOCAC itself, I suppose. I mean, local systems of care seem to be like, competent enough to deal with their own things. But like, would it not make sense for there to be some sort of affinity space specifically for local systems of care, and then have a liaison from that group be on the council, kind of like how Family Advisory Committee or how the Youth Advisory Council functions? Wouldn't that
Yeah, I
kind
mean,
of
I guess
solve,
that's kind of what I was thinking, Zafir, except that instead of adding another CCO seat to the council, when I guess like part of my hesitation, which is what people asked about, was I think CCOs have outsized power in the children's system of care already. And so adding a third seat for CCOs on a 30-person council makes them a tenth of the voices. And it doesn't feel fair to me. But I hear what everybody else is saying, and I could be wrong.
I heard someone also bring up, it might have been you, Anna, how we have also like the one tribal seat to represent 9 different tribes, right? I maybe I'm just not understanding. I feel like this could very easily, if we just say we're going to take a guy and he's going to speak for at least his, but is like, if we have a guy for like, I'm going to say Lincoln County, right? Let's say we have the guy that runs the local system of care for Lincoln County, and he's representing all the local systems of care. Like, yeah, that would be kind of gold plating him as the guy that's supposed to know what everyone else wants. But if there's already an affinity space for all of those local systems of care to come and talk amongst themselves, then why wouldn't it make sense to just have one dedicated person to transpose from a community in which all different, like with the Youth Advisory Council, we have youth from all different walks of life who have gone through all different experiences. And so when me or Jasit say something, it's not coming from just how we feel, it's coming from what we've heard from everyone on our council, regardless of if we agree with it or not. So I don't understand why that isn't the solution. I don't know. Maybe I'm missing something or misunderstanding something.
Dan?
Thanks. Question for Anna, just for clarification, then a follow-up. So, in my understanding, right, that Anna, that your concern would be that, like, if we were to add a seat for an LSOC coordinator, because the LSOC's coordinators are part of CCOs, that would increase the sort of voice of CCOs outsized on the council. Is that kind of what I'm hearing?
Yeah, that's part of it, Dan. And it's also Adam's point about, do we add a seat for everybody? And right, like, where do you draw the line? And other folks are kind of clamoring for seats. And so, how do we hear folks and without necessarily continuing to change the other pieces that it's in statute, right? So in order to add a seat, you have to change the law. And so like those are processes that are time consuming.
Right. So that sort of makes me think, well, if we've got 2 CCO seats already, why not convert one of the CCO seats into an LSOC coordinator seat? Then doesn't increase the size of the council, and it doesn't increase the voice of the CCOs, but it gives us it would give us a more targeted representative and really it versus having two CCO folks that neither of which was an LSAC coordinator. It's just like more specific and relevant. So an idea to consider.
I would sorry, Heather, I just want to respond to Dan real quick. I would hesitate with that because then you could be removing the only voice that is intended to be rural and frontier dedicated, which is one of those CCOs. I happen to operate a program that operates, well, not mostly, but in rural and frontier areas as a provider. But when I term off, it's not guaranteed that somebody will have any of that lens either. So that's the first kind of flag that I had on that.
Totally understandable.
Yeah. Heather, go ahead.
Thanks for letting me be a part of the conversation. I know typically I'm a member of the public, but I really appreciate all the points that are being made. I have thought about this so many times and I really go back and forth. And honestly, I'm like 50-50 on a lot of it because I can see benefits in, I think, really any strategy that's selected because anything is a step in the right direction. I did want to validate and honor that Anna and Christy have spent so much time engaging with all the LSOC coordinators and really trying to make sure that we remain connected and that our voices are heard in everything that you all do in the midst of not having an affinity space and not having a seat on the council. So thank you for that work and also to all of you for always listening and taking our feedback into account as you're talking and making decisions also. I think if it's helpful to add a little bit of context, and hopefully I'm not going to get myself in trouble for saying this or like at the risk of offending anybody, but I think some of the ask for a seat on the council and just some of these steps forward from an LSOC perspective has been that while we get a lot of time interfacing with Anna and Christy, we get less time with the rest of the SOCAC members. And we know you all want to know what's going on. We know that you have the same passions that we do and wholeheartedly appreciate that. And you all have like huge jobs outside of system of care. So keeping tabs on like all the things we're doing can be really hard. And so I think that's maybe where there's a little bit of a disconnect for us is, and I'm going to use us really loosely because I don't want to speak for everybody, but I think that's where a little bit of that disconnect has been. So I can definitely appreciate an affinity space where we have the dedicated time to talk about what's happening in the different subcommittee spaces where LSOC coordinators are already having like a voting seat and a voice in those spaces, and then also being able to interface with a SOCAC member that then I guess sits as our voice on the larger council. And I guess I also want to honor that I think any step in the right direction, like I said, is a good one. And maybe if a seat on the council isn't possible at this time, maybe it's a good test run to have an affinity space and have that representative appointed to serve as our liaison between the two to see if that does solve the problem or if that works. I will always go to bat for a seat at the actual table. I think that's very valuable and it would be really cool to see an LSOC coordinator in that space. And I think from my own perspective, it really depends on like and I'm not throwing shade or assuming anything, but it's like the authenticity of that seat and the authority that comes with that. And like, is it going to solve the problem? I don't know. I can also see the hesitancy around having too many CCO seats on a council. We've seen that play out in our own system of care a little bit at times, so that can be challenging. So I don't know if that really like helps or eases any minds at all, but just thanks for the conversation and keeping us in mind and advocating for us. I really appreciate it.
We are almost at time for this conversation. Sorry, but we do big hard things and then we just like, well, time's up, y'all, and we got to move on. And that's just how we are. So curious if anybody has like I see a clear next step to take. I think I'll stop talking. Does anybody see a clear next step that makes the most sense? Because we do, I'll be, okay, total transparency. We have a bill right now to add a member to the Council for Medicaid. So if we've got the statute open, we could do this as a statutory change right now. If exec feels like that's the right thing to do, we can talk with our program and policy folks. We can make that happen. It is actually like literally doable. Just because I don't think it's the best idea in the world doesn't mean it's not the best idea in the world. And we also have this LSOC charter in front of us. We can do one, we can do both, we can do none. What do you all recommend? Leo.
I think that it seems like the easiest thing to do, regardless of what direction statute takes, is to put the affinity space into play. I mean, I feel like either way, whether we decide that there's going to be a seat or that we decide there's not going to be a seat, the affinity space is probably a good idea regardless, right? So that seems like a great next step and potentially gives us a little more time to have the discussion if, if we're still at this kind of crossroads of do we or don't we?
Okay. Ebony?
I mean, if we're talking about adding a seat for Medicaid, I just think, and this is not necessarily going to help for today. I agree with the affinity space. I think that OHA is OHA, and I know that we're so massive, we're so complex that trying to show up as one entity is difficult. But if we start bifurcating and dissecting OHA, that means OHA, I mean, because I just think that if we end up deciding that we want to have a seat for Medicaid, I think it's going to be important to hear from the OHA director as well as the Medicaid director to help kind of give their thoughts and perspective. But at minimum, I think having some type of a dedicated affinity space makes sense for now.
Gotcha. Thanks, Ebony. And Zafir.
I was gonna say I thought of what I was gonna say, and it just went right out of my head. Not having a dedicated seat on the council doesn't mean that they wouldn't have a seat at the table. As how I see it. So I think the affinity space is the best course of action for now, and then later on figuring out like piece by piece, bite size. That way it's not, we can't have it perfectly right now. We're not going to do anything about it, which I'm jumping on the train of hopefully not offending anyone is an issue that we've dealt with before. And I would rather we do something than not do anything and then everyone feels bad. So that's, yeah.
Okay. So we'll move forward with the affinity space and put this conversation on the agenda again for July. And maybe we probably will not realistically have the affinity space up and running by then, but it would be ideal if we had LSOC representation at that conversation. So, I mean, Heather, I know you are representing yourself, but not necessarily representing the whole, you know what I mean? Like, it's not fair to ask you to speak on behalf of all, 14 or 15 of your colleagues or whatever. So thank you all for a brave conversation. And now I'm going to turn it over to Corinna to coach us on how we're going to test the Zoom. Oh my gosh, what is the word? It's right here in front of me. Webinar settings to see if this is the way we want to do our full council meetings moving forward. It would create some changes in how the Zoom is recorded and shared, and would make it, I think, a lot easier for the public to understand who are voting members, who are not voting members, sort of what are the roles that people are playing on the council versus the public or people who are just watching. So Corinna, I know you put a whole plan together for having us test this.
Oh,
Do you
yeah,
want to
sure.
walk us through it?
Yeah, I dropped into the chat. I just kind of divided us up a little bit, who would be panelists and who would be attendees. So if you're a panelist, you should have received an email link that'll take you to that webinar. So we will have to leave this meeting and go to a different meeting. It won't be very long, but if we have panelists and we have attendees, then we'll be able to test a couple of things. Make sure that there's no major roadblocks and issues for members of the public or others that want to join as an attendee. And so getting that feedback from you guys would be really helpful on both sides. So I'm going to drop the link for the attendee.
So Corinna, I'm not on either of those lists. Do I
You're
just
not.
drop out of this one and go home now? Is that what I
Well,
do?
if you want to come test, you can. I don't know what you have going on. If you want to come in as an attendee and give us your experience in that, and that's always helpful.
I can't hear you too well, but if I get a link, I'll join it. You won't hurt my feelings if I don't.
She said if you could join us as an attendee, that would be helpful.
Okay, so this is the attendee link here.
Yes.
Okay.
And I'm not sure if anybody is missing an invite on the panelist side.
So am I
Would they
supposed
go to our emails, Corinna?
Yeah, they should have gone to your email.
I got it.
I'm supposed to leave? Is that correct?
Yeah, so you'll need to leave and use your link, and we'll meet on the other webinar.
So
side
this,
of virtual.
I guess, technically concludes the executive meeting because now we're going to go do this testing thing. So see you all over there.
All right. See you.